Hi, Rob. Thank you so much for joining me today.
Thank you. Thanks for having me.
Hi everyone. My name is Danielle Karika, and I am the Evaluation and Engagement Manager for the Community Design Collaborative. I am joined today with Rob, who is the Director of Innovation for Design at Jefferson. So thank you so much for talking with us today. So if you could just give us a background about your organization, its mission, and the community that you serve.
I work for Jefferson. For anybody who's in Philadelphia, Jefferson is the largest provider of healthcare in the city. We now have 14 hospitals, 30,000 employees, and especially these days with the pandemic, every one of us is working as hard as we can to make sure people continue to get the healthcare that we need. And in my day-to-day role, I wear a number of hats, both in our innovation pillar here, which does tech transfer partnerships and events. But then I also co-founded and direct a lab called the Health Design Lab. And there, it's a really awesome place. That's where I am right now, where we explore the intersection of health and design in a number of different ways. Some of that relates to education. Some of that relates to actually medical care and the provision of clinical care, and also community work and thinking about what healthcare in the community looks like.
Cool. So how did you learn about the collaborative and what prompted you to apply for a design grant?
Yeah, so we first got involved with the collaborative at your annual event a couple years ago. Our CEO, Dr. Klasko, presented there, and as part of that, we realized that there was some really amazing work happening, and because what our favorite thing to do in the Health Design Lab is work in these intersections between spaces. And the collaborative does a lot of work like that. So we really were excited to have an opportunity to collaborate in a unique way around space and around how people utilize space to be healthier.
Interesting. So you worked with the collaborative on a project called CoLab, and
Mhm.
you were able to officially unveil CoLab in the summer, early fall of 2019. How did the work from your design grant help you complete the project? And what was a favorite memory or a major takeaway from the process with the collaborative?
I mean, it was absolutely critical. One of the unique things about CoLab is nothing like it has ever really been done before. It was inspired by other folks from around the country. And the whole idea was we wanted to create a mobile platform, a mobile space that we could bring into communities, and something that we designed actually with the community, both the physical space and then the programming around it. And it was critical to work with the collaborative because on day one, it was clear that the way you do things within the collaborative is to bring in your stakeholders very early on, and they're not just stakeholders; that they become your partners. And I really love that kind of structure that was in place, not just to partner us with some of the best kind of design firms in the region. We worked with Kieran Timberlake and Ballinger on this project. Were some of our key partners on this, and then making sure that we were upfront bringing in our community partners as well. So we brought in New Kensington CDC as well as Impact Services, who represented the community of Kensington. And from day one, we would hold meetings, in Kensington with folks who were from those organizations and who lived there, to make sure we were doing the right thing, right? That we were thinking about really what are their needs throughout, from when this was just an idea on paper of what could this possibly look like, until we actually got this mobile vehicle built and rolled it out with some programming in the community last summer.
That's awesome. And thank you for bringing up the community aspect of the process. We were curious to know, how did the community's response help influence or help you make decisions?
Yeah, I mean, it was important that starting from the beginning, having those community partners, not just being, and this was something that really did come from the collaborative, right? This is something that is, I think, part of your guidebook. In that we didn't start the project saying, "Oh, we are going to go out into the community and talk with folks." We started out the project saying, like, we need to bring people from the community into the project, like actually have them be, authors of this project right alongside the designers and alongside us as the stakeholders. And that changed the whole way we went about doing things throughout the entirety of the design process. So everything from, it was amazing being able just to be able to bounce these ideas off of folks who, we want their input, and being able to, hear kind of like get hard lessons taught to us, right? So when we were like, oh, we want to do this particular interventions, I remember one example, I think we said, we wanted to offer, we were talking about a program. You're like, all right, what if we offer discounted, meal packages to folks in the community? And, immediately somebody was like, listen, that's not going to work. Like there's a number of reasons why that's not going to work, and we can talk about them right now. Because, from the very beginning, the whole point of our design was not just that physical thing, but also like the programs that surround it, and also to the kind of, I guess you could say, the mission and the ethos that surrounded it. And having the community buy-in and input from the beginning made sure that when we rolled it out last summer, nobody was asking like, why are you doing this and what does it stand for? We had already answered that throughout the process.
Oh, wow, that's so important. I think what you're getting to is so significant. When the community has an understanding and an education of what it is, it makes them feel safer. It makes them feel like they have a say and a know. And so that's really important. Thank you for sharing that. So has CoLab been in use since the pandemic onset, as you mentioned earlier? And if so, has it had to be adapted or modified?
It has. So, the thing I'm most sad about, the pandemic has been challenging for everybody. It's been really sad for me, especially because the summertime is usually when we do my favorite work. And that's the work where we take our students, we take interns from around the regions, and not just from here at Jefferson University. We take a lot of students from Princeton and other locations, and they come here to work with us in the community. And usually what we'll do is we'll partner with organizations, and we'll get out there and we'll work with people. And that's what CoLab was built to do. And unfortunately, because of the pandemic, we've had to cancel a lot of that because we just don't have the students. And we're still trying to figure out what can we do back out in the community with CoLab. Right now, it's not sitting unused. It's actually a command center for our mobile testing site here in Center City. So it's currently parked outside, and it's used for a number of things, but to help our COVID, as they're now known as the swab squad, helping out the swab squad as they gained some popularity from their sweet Tic Tac video. And they were on Ellen and everything. So everybody knows about the swab squad.
Yeah.
So the swab squad has been hanging out in the trailer while people from around Philadelphia come and access testing here in our mobile site. And what we're trying to think about now is, as the pandemic's not over, but things are changing and the community needs are greater than they've ever been. What can we do to put this back on the road? And what can we do to bring CoLab on the road? Maybe it's offering mobile testing in the areas where people don't have the ability to get out from where they are, and so they can access that much needed testing where they live.
Wow, that's great and really important. And I think it speaks to the, like when you become mobile and when you're able to move around and get a farther reach, how much that's going to help the necessary needing for the sort of research that's to come in terms of how we're going to enact with and work against this current situation. So
Yep.
that's important. So you've touched on this a little bit, but I just want to ask, so beyond CoLab, how has your organization been impacted by the pandemic? And are there any issues that the collaborative could possibly help you address?
Yeah, I think, some of the biggest questions are, how do we get back out into the community? We're lucky because we have CoLab. It was designed to be our arm into the community. It's hard to build buildings. It's hard to set up sites, and but the needs are everywhere, not just around where it's convenient to have where we have a hospital or where it's convenient to have a site. There's amazing community-based organizations out there who are in the communities that need help. And again, one of the reasons why we developed CoLab was to offer our support to them as well. So, across the organization, I think, we've all been trying to think about, how do we get back out there and how do we continue to serve Philadelphians, where they live. And, we're always open to the innovative ideas and how we can do that.
Awesome. Well, thank you so much for taking time to speak with us today. Is there anywhere that we can find more information about CoLab online?
Yep, definitely. You can go to the Health Design Lab website is where our CoLab information lives, and it's at healthdesignlab.com. And if you want any information about Jefferson, you can always find us at, jefferson.edu.
Awesome. Thank you again so much, Rob.
Thank you very much. Have a good one, Danielle.